Hey, this is Dr. Barry. In this quick video, I want to talk to you about 7 drugs that your doctor might give you that can actually raise your blood sugar. And then I'm going to include a bonus 8th drug that all the women need to know about because it's really a big deal in their lives. So if you go to your doctor, you really want him to take your entire health as kind of a global picture, right? But if he just blindly, thoughtlessly prescribes you one of these medications, he can actually be maybe helping one problem a little, but making another problem a whole lot worse. Now, if this sounds like something you enjoy listening to, please click the subscribe button. That way you know when I make a new video. And if you'll click the little bell right beside it, then you get a notification every time I have a new idea. Now let's talk about these drugs that elevate your blood sugar and you maybe didn't even know it, okay? Number one is steroids, corticosteroids of any kind. It's well known in medical science that they elevate your blood sugar. Now, sometimes if a thoughtful doctor has prescribed you a short course of prednisone or Medrol or one of the corticosteroids, you may actually need that. And the elevation in your blood sugar may be so minimal and so short term that it doesn't really matter. But always ask your doctor if he prescribes you a steroid, especially if it's a long term, daily for months and months and months. You need to really question your doctor and think together, is this really worth it? Because this could cause me to have diabetes. Type 2 diabetes can absolutely come from taking too much steroid for too long. So all in this video and in all my videos, I never ever advocate you stopping a medicine without talking to your doctor. If you're on something for a medical condition, go talk to your doctor and say, hey, I heard on the internet that this steroid, if I'm taking 10 milligrams a day for months and months, could actually cause me to have diabetes. Is that true? Then you open the dialogue. And either you find out that you have a great doctor who's willing to discuss this with you and knows what he's talking about, or you discover that you might need to find a new doctor, right? Number two is beta blockers. That's a class of medications that doctors use either for high blood pressure or some heart conditions. The two biggest ones in this group you may have heard of or may even be taking are atenolol and metoprolol. And these guys are kind of the older beta blockers. Some of the newer beta blockers may not really elevate your blood sugar that much, but it's still worth asking your doctor about. But if you're taking atenolol or metoprolol, go see your doctor or your cardiologist and say, hey, can I not take something else that doesn't raise my blood sugar? Because I heard this medicine can actually lead to type 2 diabetes. Big deal, right? Number three, Zyprexa. Now, Zyprexa is an antipsychotic. We used to only use this for people with schizophrenia or other psychotic diagnoses, right? But more and more, the manufacturer of this drug is marketing it for mood stabilization, even severe depression, and more doctors and providers are using it for that. And a lot of them may not even be aware that Zyprexa can raise your blood sugar. It's a known fact, but sometimes as doctors, we're just so busy in our practice, we just don't think about every single side effect that a medication can have. So I would hate to improve your depression a little bit with this medication, but then cause you to become a type 2 diabetic by taking it long term. So ask your doctor if you're taking Zyprexa, isn't there something I can take or maybe just not take this at all that won't raise my blood sugar? It's a valid question. The next is my favorite class of drugs. That's that sarcasm again. Statins, lovastatin, atorvastatin, Lipitor, Zocor, Pravastatin, right? Pravachol, all those guys, all of them, it's been known for over a decade. They raise your blood sugar. There's no ifs, ands, or buts. If your doctor says that's not true, he needs to go back and do his reading because it is absolutely true. In fact, if you're on a statin right now, you might just want to share this video on your social media and tag your doctor or your provider in it and say, hey, does this raise my blood sugar? That might be a wake-up call for your doctor and for lots of his patients, right? Just a thought. You don't have to do that. Never mind. Don't do that. That might be rude. I don't know. Whatever you want to do, it's fine. But anyway, statins have been shown really to help very little most people. There's only a very few people who it's medically proven by the research that they need a statin, okay? Most people taking a statin for primary prevention of heart disease are taking a pill for nothing. So do your research into this, talk to your doctor, and if your doctor gets offended that you ask this question, well, you know what you may need to do then. But hopefully your doctor will be open to this discussion and will do a little extra research, and you and your doctor can come to a conclusion together about taking a statin or not. The next medication is phenobarbital. This is an anti-seizure medication. It also makes people sleepy. It used to be prescribed a lot more. It's usually very rare now, but if you have a seizure disorder, you may be taking phenobarbital, and there's several different brand names of this. So if you're taking phenobarbital, go see your doctor or your neurologist and say, hey, is there not another anti-seizure medicine I can take? Because I'm afraid this one's going to elevate my blood sugar. And when you say that, your doctor or neurologist will either be very impressed that you know that or very irritated that you brought that up. Either way, you know what to do, right? At least you open the conversation. Now, the next one, number 6, is a drug that I know many of you take. Even some of my patients take this. It's hydrochlorothiazide, or HCTZ, or HCT, and it's any of the thiazide diuretics. And there's several different brand names and also several different genetics and or generics in this drug class. But look at your medication, and if it has the letters HCTZ or HCT, then you're taking a thiazide diuretic. And it's absolutely true. They can raise your blood pressure, not your blood pressure, no. They can raise your blood sugar either a little bit or a lot of bit. And so you really, if you're taking HCTZ, a thiazide diuretic, or any of the medications on this list, you need a glucometer so that you can check your blood sugars and make sure that they're not getting out of hand. Because it's absolutely true. Some people can take these medications and not have any problems. But you don't know if you're one of those people unless you're checking your blood sugar. And I've got another video on this channel about how to use a glucometer strategically to either watch your diabetes or to prevent yourself from ever becoming a diabetic. So the thiazide diuretics sometimes are necessary. Sometimes you can't take anything else for blood pressure or for fluid issues that you may be taking it for. But if it's possible, go see your doctor and say, hey, can I not please take another diuretic besides HCTZ or one of the thiazides? I heard it can raise my blood sugar. And then you'll have that good open dialogue with your doctor as you guys talk meaningfully and thoughtfully together about your medical health. Next is the decongestants, okay? Sudafed, phenylephrine, a lot of these different guys can raise your blood sugar. And so if you're just going to take them for 2, 3, 4 days because you got a cold or something, that's probably fine. It's probably not a big deal unless you're an uncontrolled diabetic, and then it may raise your blood sugar to the danger point. But if you're not a diabetic, or if you are and it's well controlled, you can probably take these for 2 or 3 days, but just be more vigilant with checking that blood sugar with your glucometer, because you really want to know, is this raising your blood sugar or not? Now, ladies, are you ready for your bonus prescription medication? Conjugated estrogens. Any conjugated estrogen, which basically means a fake estrogen that you take in the form of a pill, is absolutely proven without doubt to raise your blood sugar. Now, for some women, it'll raise it a little bit. For other women, it'll raise it a lot of bit. If you're taking a conjugated estrogen, I recommend you have a glucometer and keep a closer eye on your blood sugar. You can get a glucometer at the pharmacy without a prescription. I actually, in my video on this channel about glucometer use, I've got a link off Amazon to a very cheap glucometer that you can get with very cheap supplies. And so, because I don't want you to spend a lot of money on this, but I do want you to be aware, and I want you to be in the know so you know what your blood sugar is. If you're taking a birth control pill, ladies, if you're taking a pill form of hormone for your menopause, you're absolutely going to increase your blood sugar a little bit, and that's a big deal. I'd much rather you optimize your hormones if you're menopausal, premenopausal, or postmenopausal with a bioidentical hormone product, right? But if you are taking a hormone pill, an estrogen pill, and it's fake estrogen, it's not real, right? Because you can't get real estrogen in a pill, your liver would just digest it immediately. So if you're taking an estrogen, ladies, of any kind by mouth as a pill, check the blood sugar, make sure it's not getting out of hand. Maybe go talk to your doctor and say, hey, can I not use a real bioidentical hormone? Or if you're taking the estrogen for birth control, see if there's not another method of birth control that you maybe can use. Now, if you enjoyed this video, please share it on your social media. You know you have friends and relatives who are females or who have high blood pressure or who have any of these conditions and may be taking one of these medicines. You sharing this video can make all the difference whether they become a type 2 diabetic or whether they don't. Okay, so please share this on your social media. And if you really enjoy the messages that I put out on these videos, I've got a link down below to my Patreon page. You can go there and throw me a buck or two, and it helps give me more time to keep doing what I do right here. This is Dr. Berry. I'll see you next time.